It's going slowly. All right, that is up and good to go.
Okay. It's 5:31. Shall we go?
Yep.
Good afternoon, everyone. I'd like to call to order this public hearing and meeting of the Health and Human Services Board for August 27th. I will go ahead and call the roll. Gary Steen.
Here.
Sarah Kennedy. You're muted, Sarah. We know she's here.
I'm here.
Bonnie Barker.
I'm here.
Jody Comrie.
Here.
And Bill Lamb.
I'm here.
And we expect that others will perhaps be joining us. We understand that the Committee on Administration is still meeting, so I rather expect Chairman Bartlett and Keith Stray to join us. I will officially call the public hearing to order. However, it is my understanding that we do not have any public comment today.
That is correct. No one replied to, or no one asked for an invite to this meeting.
Okay, and nothing, we received nothing in the mail.
No.
Okay, well, I will go ahead then and adjourn the public hearing. We need to approve the meeting minutes. It reads in the agenda for August 27th. I actually think it should probably read July 23rd.
It should.
And I think I have a motion from Supervisor Steen. Is there a second?
I'll second.
Thank you, Bonnie Barker.
I think we're just being proactive.
I know. Let's get a head start on things, right? Right, absolutely. Any additions, corrections, anything that anybody saw? All right, then, all in favor of approving the minutes from July 23rd, say aye.
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 Good. All right, let's go. Greg Quinn is with us from Veteran Service. Are you ready to take this portion of the meeting, Greg?
I am. Yes.
Good.
So good evening, everyone. I'll just do a quick kind of overview of some items over the last month going on within the office before I'll lead into the budget portion. We've seen a significant uptick in requests for financial assistance over the last month. So we're spending a great deal of time. Three different homeless veterans over the last month. A couple resulted in hotel stays. One ended up at veterans homeless shelters. So it's good that our partners are active, and so we're able to mitigate a lot of those. But I anticipate that uptick to continue given the current environment. Another significant thing, just because of the pandemic and the way that we provide services, we wanted to get an idea of our customers, clients, how willing and open they are to doing video meetings and to continue with the current operational requirements. And so I included that in the packet that went out to everybody. So it was good to see that the majority of the people are willing to do whatever's necessary and required to continue business as usual. So that was encouraging. The last thing is I just report there's nothing significant to report in the budget. However, I do anticipate probably the $2,000 to $3,000 savings at the end of this fiscal year, just due to the pandemic and the restrictions on training and travel that we've had. So that's I'd say a positive thing with the pandemic regarding the budget.
Right.
Any questions regarding that information that I had just
No, but thank you for sharing the survey results. I thought that was quite interesting and good of you to do with your clients.
Yeah, we definitely want their input. If we don't have them, we don't have a job. So I'll lead into the 2021 budget. The main snapshot is there's a 2.84% increase from the 2020 fiscal year to the 2021 proposed budget. The costs of that 2.84% increase are all costs that are outside of the requirements that are on me. Those come in with benefits as well as the proposed salary increases, and then the IT budget that is provided to us to populate into the budget. So I complied with the direction of the county manager to bring in a 0% increase in the portions that we had control over. So that's kind of the overall synopsis of the budget and why it shows a 2.84% increase. We're anticipating a similar as far as revenue, flag sales, as well as state reimbursement for transportation. We usually anticipate about $800 in revenue. This next year, it will be reduced because travel has been restricted because of the elective type care has been reduced for quite a while for the Veterans Administration. But there are some proposals coming from the state level that I've kind of got my ear to the ground that we might be able to still get our a little bit more to help with the transportation program. So leading into the budget costs, as you can see there, the percentage in the increases in the areas are those areas related to benefits as well as IT. All other items that we have as far as the conference, seminars, operating supplies, all of those items were complied with to have a 0% increase as directed. Moving.
Greg, can I just
Yes.
ask a question? I've got the budget up here. Are you looking at a different document than I, because it says 2.96% increase.
On the summary, down the total revenue, total expenses, that shows a 2.84 once the $10,000 grant is added into that.
Okay.
That's on the summary page.
Yeah. Okay.
That
Yep.
answer your question?
Yes, it does. Thank you very much.
Okay. You're welcome.
Greg,
Yes.
my question is the percentage increase based on your budget for this year, or is it based on what you actually spent this year or planning on?
The budget percentage increase is solely based upon what our adopted budget was for fiscal year 2020. So our fiscal year 2020 budget, as I had explained earlier, I anticipate that being less because of some of the COVID restrictions on travel and training. Does that answer your question?
Yeah, that answers my question. And I think that's how it should be, not on what you saved because of the COVID, but on what you proposed, last year.
Mm-hmm. So I'll move on to our soldiers and sailors relief fund. We're requesting the same amount of $13,146 that goes directly towards the support and relief requests of our veterans, and we have a policy in place to only approve those particular requests that are for basic needs. And the Veterans Service Commission is the overseer of that particular pot of money to ensure that we're being fiscally responsible for that. I do have budgeted on here the Veterans Service Commissioner expense. Those are for meeting expenses. However, what I've learned is those expenses for those meetings are actually come through the county clerk's office now, which in the past they used to come through the soldier and sailors relief costs when we'd have a meeting to cover the per diem costs for our commissioners. So the dollar amount doesn't change, the line items will. I'll move to the last cost center that we have for the veterans budget. It's the County Veteran Service Officer grant. The grant has been basically stagnant the same for, I think it's 10 to 15 years now,
Wow.
$10,000 that's granted. There's proposals to change the formula that will benefit some more of the rural, smaller counties versus the larger counties to get an increase in that money. So I am keeping an eye on that potential. But right now, the information that we know is that we can anticipate a $10,000 grant that'll come in to help support the activities that we do. Any questions regarding the budget as I presented it?
Yes, Greg, I have one more. I need to
Yep.
find it. Back up under veteran service total revenue, you have a note. On overtime, it is budgeted at 300, but you have a note.
Correct. Yes.
I want to have $1,000 of overtime due to a 2-staff office.
Correct. Yes, I've had that in there. That's my way to say that it would be helpful to be able to offer some overtime when it comes to office coverage. Try to rely a lot upon volunteers and stuff, and because it does allow us to be able to take vacation a little bit easier. And it's not for myself because, of course, I'm a salaried employee, but this would be able to cover staff that's in the office. We have one staff, so it can limit things. And so I always put that in there. Historically, the formula has been upon what has been utilized the previous year, and we've been kind of stuck at that around the $300 overtime because of 1 year there was a reduction. It used to be $2,500, I think. And don't necessarily quote me on it, but I think it was about 4 to 5 years ago for overtime. But we utilized less of that overtime and used comp time to finish to work with the employee that's in that position. So I just ask for it. You know, ultimately, if money's not there, it's not there. But I'm not doing my due diligence if I don't put the request forward.
So you would like to see the addition of $700 in that item?
It'd be helpful, yes.
I note that our CFO is on. Keith, can you comment on that, please? You're muted, Keith.
3 hours, 4 hours of consecutive meetings.
I know, I'm sorry about that.
Oh, no worries, no worries. I'm crying in my beer. Sorry, guys. Really, Greg hit the nail on the head. The county's facing, as reported on July 29th, a $1.1 million deficit in where it has to be with its tax levy. You know, new requests like this, there's a lot of things that are identified as things that departments would like or need or would prefer to have, but the reality is the money isn't there. That's really the challenge that we're all dealing with.
Yeah, even for relatively small amounts.
The upside that I'd say is that the $300 was left in there, and I know that, you know, all eyes are upon, hey, don't use the overtime if you absolutely don't have to because of the budget constraints. But to try to give an accurate picture of what we believe the needs are of the office, so I just put the note in there.
Okay, all right. Other members have questions or observations or anything for Greg or Keith to respond to? No? Anything else that you want to share with us, Greg?
No, that kind of concludes my report.
All right, well, this is an action item. I would entertain a motion to approve the Veterans Service 2021 proposed budget. Supervisor Steen, is there a second?
This is Bill, I will.
Mr. Lamb seconds. All in favor?
Aye.
Aye. Any opposed? Your budget will move on to exec. Thank you, Greg.
Thank you.
Okay, I think we move next to the health department. I'm just pulling up the budget folder. Katie, you wanted to do an information item and then move on to budget considerations. So you want to start with that?
Sure, absolutely. So what you have in email form earlier today, I think it went out around 5, is a couple informational items for you regarding non-pharmaceutical interventions, including masks. And so what that is a lit review with many different sources and many different types of studies, looking at the efficacy of different interventions. So that's physical distancing, that's mask use, that's good hygiene. And so I don't know that I didn't give you enough time, quite frankly, to dig through it and have substantive questions. And I need to acknowledge that. But I did want to get that back to you because it was requested at the last meeting.
Okay, thank you. All right, so we move into budget for the health department.
Sure. And for that, I'm going to go ahead and lean into Sarah Stavanaugh. Honestly, with the vast majority of my time being consumed by COVID, I really have had to lean into finance and the support that they've provided, recognizing that we also followed the instruction to keep things flat where we could. There are still at play additional grant funding that's not reflected in this budget. We were just verbally told by the state, we don't have anything in writing, that our ELC grant for next year to support contact tracing, that's epidemiology, laboratory, I can't remember what the C stands for, I'm sorry. Instead of just a handful of thousands of dollars, we're actually looking at $250,000 to support contact tracing in the following year. That's not reflected. But Sarah, would you, with that in mind, would you mind sharing a little bit about the nuts and bolts of the budget we've put forward?
And Sarah, may I just interject that Chairman Bartlett has joined us, Sarah Schaefer has joined us, and Mr. Miller has also joined. So welcome, everybody. Please, Sarah, go ahead.
Can you all hear me?
Yeah.
All right, great. It's my first time with my new equipment, so I'm testing it out. Sorry. Did you all get the budget sheets for health department?
Yes, I believe so.
Okay. So for the revenue for the health department, excluding grants, they're going to ask for, there's going to be $1,001,433. And with grant revenue, there'll be $398,806 for grant revenue. So that gives a total revenue of $1,004,239. And then the expenses match that. I went into a little bit of detail, just trying to get some numbers for you and stuff. The 2020 budget was amended. It started out at $1,371,338. It now stands for the health department with all the budget adjustments and everything at $1,899,442. That's due to COVID and other adjustments that have been made. The tax levy ask for 2020 was $461,193. The tax levy ask right now as it stands in the budget is $507,912. So that's an increase of $46,719. The salary and fringe increase, I broke that down on a different document. I didn't have a chance to send it out to you. The salary and fringe for 2020 was $1,226,793. And for 2021, the salary and fringe is at $1,243,503. That's an increase of $16,710. Is there any other questions? I know I kind of went through that fast through.
Good. Do you want us to take us through any of the cost centers, KT, or are we good?
So I don't have any cost centers that I think are substantively changing. Again, our largest expense, of course, is people. We continue to have costs associated with reproductive health that we, because of COVID, have not been able to, so we're not incurring those costs, but we're also not being reimbursed for those costs. So I think that that's important to note. We are, however, able to use our reproductive health grant for COVID response. So it's kind of coming out as a wash for this year, and anticipating that we will, as much as I'd like for COVID-19 to be over, I anticipate that we will continue to work through this next year.
Okay. And communicable, I don't know why I have trouble saying that. Communicable disease budget is reduced a bit, 5.8%.
Sure.
Can you talk about that?
Yeah, we do have a state, a series of normal grants that communicable disease encompass. So that's our immunization program. That's a very small amount of money for straight communicable disease follow-up. And that has a reduction associated with a couple different normal grant items. That is more than going to be offset with the additional funding being provided for COVID-19.
Okay.
But it is reflected in our normal grants as a reduction.
Thank you. Questions? Anything that the committee members would like to discuss here?
Am I coming through?
Yes, Supervisor Bjork. Thank you for joining. Any questions on the health department budget? Well, that was easy. It seems like we're ready for action. I would entertain a motion to approve the health department budget for 2021.
I'll make a motion.
Ms. Barker, is there a second? Mr. Steen, all in favor?
Aye.
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 All right, the budget is approved for 2021. Thank you all. There's a budget adjustment here also, KT, and you have that in your packet.
Right, and so that's just a small amount of dollars that we've actually received and used because it is related to COVID. There was a grant received from the Women's Giving Circle to support the specific purchase of coolers for vaccine. We could use that for influenza or COVID. And so that's why we went ahead and made the purchase right away. That was in the grant application, and it's true to the intention of the dollars behind it.
We have been approving these budget adjustments separately for the health department and human services. So I'd like a motion to approve the $1,600 budget adjustment for the health department. Supervisor Steen, is there a second? Supervisor Cromrie, any questions or discussion? All in favor? Aye.
Aye.
That is approved. Thank you. And annual report, KT, is on our agenda.
Sure. And so again, this came out to you very late, and I apologize. This is typically we are required by state to have an annual report put together in April. And because we were just ramping up for COVID, that was extended. I still don't have a requirement to provide an annual report to the state, but I figure we're pretty far into the year, and we might as well get it put together and put out for you. So you have it in an email that was sent out just after 5. I can absolutely share my screen if you would find value in that. But what it is an update on kind of the numbers behind the health department, the things that we measure and do, and can put some numbers behind that, as well as some background information for our community and our budget. So the next part of this is to send this on to the whole, because we're not doing presentations anymore with our Zoom format, but it would be on to the next round of standing committee and then to the executive committee.
The members have not had a chance to review the report. Can we postpone this until, your light's going off again. Can we postpone this until next month?
Absolutely.
Is that acceptable? Chairman Bartlett, is that acceptable to postpone? Yeah, okay,
Yes.
that's good. We will put that on the agenda for next month and give you a little extra time. And please, don't apologize. I think we know how busy you have been, and I think everybody on the committee would join me in telling you that you've been doing a really great job. So no apologies are necessary. Thank you very much.
Thank you.
Okay, Department of Human Services. This is going really fast. What's wrong?
Don't jinx it.
I'm not jinxing it. So let's turn this over to Chris Corpola. Oh, yeah.
First I have to unmute. I can't even see my lips moving to say that I'm yapping away behind this mask. Okay, so first I have to apologize because I made a relatively significant error in the agenda as I look at it, because I knew this was going to be a long meeting, but I was supposed to include discussion of our 2021 legislative agenda.
No.
So I don't know, Mr. Miller, can we pick it up in September? Is that too late? What's this?
You can pick it up in September. Your job depends on remembering to include it at that time.
Oh, good. I'll be sure to forget that one.
I actually was going to suggest that perhaps we should consult on the agenda. So the things that I forget, you can add, and the things that you forget, I can add. So let's also put that on the agenda for next month.
Yes. So I very much apologize for that. I had every intention of putting it on there, and I look at it and it's not on there. Okay, so 2021 budget. So I am going to, you have what was sent out in the board packet. And I'm going to share my screen as well to show you. So if you, you are welcome to flip to, sorry that your pages are not numbered, but if you flip to the last page of the expenses, so it would be about 5 or 6 pages in. It's a half a page document that ends with budgeted expenses, revenue, and county levy. So when Sarah and I worked to complete this budget submission back in May, we did so with a couple of premises. At that point in time, the what is called what is our staff financial salary and fringe accounting, we call it a PEP. That included a 2% increase, and as well as the way that our compensation grid for the county works is that there's you come in and you generally start in a certain grade based on your position. They're all classified onto that grade, and then you move up by the steps in that grade. So there are 2.75% differences between step 1 and step 2. Generally, people have moved on an annual basis. So let's say you came into the county, you started on grade 1, step 1. I'm just going to make up a dollar amount and say you were making $10 an hour. At step 2, you'd make $10.27 an hour, and on up from there. So people do generally advance a step each year until they get to step 11, at which time they're considered topped out on the compensation grid. And then after that point in time, they only receive the cost of living increases if there indeed are any. So the original budget, the original PEP spreadsheet includes all the staff that would be in line to move up a step, and then it raises the entire grid roughly 2%. And then the other thing that was on that, and Greg alluded to this, was the IT replacement costs. So there's two IT related expenses that are incurred by the departments. The first are the regular costs to have IT service to our departments. So the costs for the licensing, for Google, for any of the specialty systems that we might have, for our telephones, for all of those various things that are included in IT. But there's also a amount given to us that tells us we have equipment that needs to be replaced on a whatever rotating schedule is set. And there's a dollar amount attached to that. So maybe this year we need to replace 25 monitors and 5 laptops and 7 printers or whatever that might be. So the initial budget included $208,000 worth of salary and step increases, and $69,000, and I'm rounding this, $69,000 worth of IT replacement costs. So the other thing that is a little hard for me, I wish I had a better way to show you this in person or illustrate this in person by kind of drawing it out for you. But the other thing that comes into play with our budget is, so we too follow the request or the directive to have a 0% operational increase. And the way we calculate that is, the simplest way to say that is that we have expenses. We have revenues that come to us from different sources, some of them state allocation, kind of our equivalent of shared revenue, state allocations from the various departments, and then what we are able to claim in third-party billing kinds of activities. So those cover a broad range of things. They include activities in our behavioral health clinic. So when someone comes in and receives psychiatry or therapy, if they have an insurance, Medicaid, Medicare, or a third-party payer private insurance, we bill for those services, and whatever we receive back in that is a form of revenue. And the other are things that we're able to collect back on. So for instance, when some children go into foster care, if their parents are receiving an SSI payment for them, we will pull that SSI payment back through Social Security to us to reimburse us for some of the cost of care. So there's kind of those 3 pots of money, the allocations from the state, the third-party billing, and then the collections kinds of activities that we can engage in. And then whatever we're not able to, so we have expenses, we have our revenues, and the difference ends up being the county levy. So when our expenses go up, we may well have a corresponding revenue that offsets those expenses. So the best illustration, and this actually is part of what happened in between the first round and what I'm calling round 2 in our budget, is our children's long-term support waiver program. We had budgeted in the first round for about $1 million of expenses, and about something close to $1 million worth of revenue. I don't know the exact dollars amount, not quite. That program is a program where we recoup any place between 90 and 97% of our cost. So, so we had $1 million of expenses, but we also had a corresponding revenue. That program in and of itself in 2020 was only 2019 was only budgeted for $600,000, because that's all that was being spent there. But it varies depending on the kids that come into the program. So if you get a very high need, you get some very high needs kids. Let me give you one practical illustration. We had a little guy who was born with a plethora of disabling conditions. He was in the hospital, a children's hospital in St. Paul for several months after his birth. He required to come home on oxygen oxygen, to receive oxygen. And his mom, who was a single mom, was unable to find a Medicaid provider in Wisconsin who would provide oxygen services for him because the reimbursement rate for it is so low. So he was essentially in the hospital because we couldn't provide the wraparound services. She could not find a provider to provide the wraparound services for him to be able to come home. The Children's Long-Term Support Waiver was able to step in and partially fund that some of that difference, and he was able to come home. But it was about a $40,000 a year adventure to have oxygen. So I say that to say that the costs vary by the year, but we plan on, and we know that we will receive at least 90% of what we expend back. And that's kind of how we've budgeted historically. So all that's a really long way to say, let me just spit a couple of numbers at you. In the first round, with the salary and the step increases and the IT replacement costs, we were going to increase our levy request by $277,000. And actually there was a slight, if you're looking at your first round information, you see that down there in the corner. So it was there's a little miscalculation. Well, there was a slight adjustment to that in the second round, but it was at that point in time when we submitted, it was $277,526. Of that, if you look at if you go a couple of lines up from that, and if you did the math, you would know that our operating costs actually increased by $470,000. But there was a corresponding revenue corresponding revenues that offset those increases. So while I tell you that we brought in a 0% levy increase, we did not bring in a 0% operational increase, because when there's a expense and there's a revenue, it's a net zero change to the county. So in the second round, or what I'm calling the second round anyway, which is what you see up in front of you now on the screen. What we did was there were some significant changes for us. So one, the current PEP spreadsheets are now set with a 2% increase across the board, but no step increases. So whether you're in step 1 or you're in step 11, whether you're on grade 1 or in your grade 25, you would receive a 2% cost of living increase, but you wouldn't move up a step. That in and of itself saves, in our department, saves about, sorry, let me quick do the math, about $140,000. So it was about $200,000, a little over $200,000 to do the 2% and the step. It's about $70,000 to do just the 2% increase. The other thing that happened is that part of what is working its way through as a potential is looking at moving some of those some if not all of those IT replacement costs, and utilizing what we can in COVID funding to pay for them this year and not have to pay for them next year. And we've been successful through a number of pots of money, and many of those pots of money come to us specifically earmarked to be able to purchase equipment for people to be able to work remotely. So if I have an aging laptop and my ability to continue to work remotely depends on my ability to have a functional laptop, and I was due for a replacement, it's a legitimate cost, and many of the COVID claiming for that cost to be claimed to those COVID pots of money. So as a result of that, then that $69,000 of IT replacement cost has come out of our second round of budget as well.
Okay.
The other major things that have happened since between round 1 and round 2, and we're going to talk about this in a little bit, but it is in this second round projected at this point in time, is that we have administered a program called the Wisconsin Home Energy Assistance Program. Basically, every month when you pay your electric and fuel bill, whether you pay it to XL Energy, Dun Electric, We Energies. If you look closely on your bill, there's a little spot where it tells you that there's a small amount of your payment that goes into a fund that's redistributed back out to people who are low income through the Wisconsin Home Energy Assistance Program. And we have administered that program for a bazillion years. I know that's not a very specific amount, but it's as long as I've been here and then longer before that. It is a program that's provided, the funding comes through the Department of Administration on the state level. And we serve about 2,000 people a year in that program. This past summer, there was a series of changes. They were going to extend the program. It typically runs from May until October, or sorry, other way around, October until May. This year, they were going to extend it through the summer as a result of COVID. We told them that would potentially result in us incurring some 2021 costs because of insurance coverage and a look back, and that was detailed in the information that I sent you, and we'll talk about it after a bit. But the end result was they said, well, what if we, instead of that, West Cap administers the WEAP program for us in St. Croix County. What if we contract with West Cap for the summer? And after some talking that all through and figuring that out, we were good with that plan. Recently, West Cap came to us and said, would you consider passing on the administration of this program to us across the board? And so we evaluated that. I'll talk to you about the logic to that when we get to that as an action item. But this budget does include the removal of our administration of the WEAP program. Also, the state of Wisconsin is doing a significant change in 2021 in terms of how it administers something called the Children's Long-Term Support Program. It's a program that provides wraparound services to children who, through Medicaid, for children who are disabled. Sort of the long story short is that we used to have to account for some ins and outs that were paid on our behalf by a third-party payer, Wisconsin Physicians Services, WPS Insurance Company, was a third-party administrator for that Children's Long-Term Support Program. In 2021, the state is going to contract directly with them for a significant piece of that program and take the counties out of the middle of it. So there were the significant changes in the waiver program. We had some small increases in our income maintenance allocation and our child welfare allocation. Those are the only two that we've had updates on so far this year. There will continue to be updates as we work through the fall. So the end result to all of that, as I babble on at you, is, and let me just say one other thing. We also have two ways that salary and fringe costs impact our budget. So one is on the county side, we have 60 county staff, roughly. It varies sort of by the month, depending on whether all positions are full or not. We have about 60 county staff, and we have about 40 leased staff through house calls. And those staff are all co-located with us. They often share the same responsibilities as county staff. There's a long history of that leased relationship. Because we could have a county social worker and we could have a house call social worker, for a very long time, we have provided funding to house calls to provide the same salary increases to house call staff as there are to county staff. However, the house calls increases show up on the operational side of our budget because they are, it's a contract services, contract service. So, so when all of that's said and done, in the second round of budget, because of the removal of that waiver program, because of the removal of the WEAP program, and because of a little bit less of house calls costs, because we're removing the step increases for them as well, they have their own pay grid, the funding for that, we actually have an operational decrease of $329,000. So in the first round, we had an operational increase of 470,000.
Right.
Second round, we have a decrease of 329,000. And our levy ask decreases to $82,000. So it was previously 277. And now you can look at the page that I'm looking at and you can see that. So if you look in column J, it tells you now what our salary looks like, what our operational costs look like, our total minus our revenue, and the bottom line is the county levy. And then the math is right to the right of that in column K, tells you our ask would be $82,208 in levy. And that is a decrease from the, like I say, there was some adjustments in the first round from the 294 that would have been in the first round. So it's a $212,000 reduction in round two. And let me just provide you, I'm going to spit these numbers at you, and I'm sorry that you can't see them, but let me just, if you can kind of just sort of track this in your brain as I'm saying it. In 20, and I'm just going to round some numbers for you so that that's not unduly to the last dollar kind of thing. But in 2017, we budgeted about $3.1 million in levy. We used $3.6 million, and about $406,000 was moved from the general fund to make us whole at the end of the year. In 2018, we budgeted $3.1 million. Again, we used $3.9 million, and the audit moved $750,000 from the general fund to make us whole at the end of the year. In 2019, we budgeted $4.4 million, an increase of over $1 million. We used 3.5 million of that and returned about $900,000 to the general fund. And in 2020, we budgeted for about $4.1 million. We're anticipating at this point returning about $200,000 of that with half of a year's of expenditures recorded. And in 2021, we're requesting 4.178 million. So it's like I say, it's the $82 million or $82,000 over last year.
You've done a good job with round two. Are there, since the members of the committee have had access to round one in the budget spreadsheets, is there anything in the cost centers that you want to go over with us? Any changes that you want to highlight?
The only thing that I would say, they look relatively the same. I mean, so it's really difficult because things move significantly.
Yes.
Those of you who've been with this committee for a long time know that I've done some of that graphing out for you. And a lot of times our expenses look like a spaghetti plate because things go up and down. It might be a year in which we have a significant increase in children's placements and a decrease in some other areas. It might be a year that we have an increase in adult placements and a decrease in children's placements. Right now, our family and children's services placements look and services look pretty good. There was an infusion. If you'll recall, we had an infusion of money into that program coming into this year of about $246,000, I think, as a result of our advocacy efforts to get some additional state monies into that program. And that's been helpful to stabilize that program. However, our adult placements continue to, our adult emergency detention costs continue to be a high cost item for us. So as of July, we have spent $485,000 at Winnebago Mental Health Facility. Again, when someone's emergency detained at Winnebago, it's about $1,300 a day. They end up at Winnebago because there are not local beds available. And law enforcement transports them. So there are additional law enforcement costs, which are not reflected in our budget. And Winnebago bills us back the full cost of their care, and then they slowly refund us or reimburse us if they're able to collect from any third-party payer. So if the person has Medicare or happens to be one of the small pieces of the population that for which Medicaid covers, or have a third-party insurance, they reimburse us. So far we have received about $181,000 worth of reimbursements, but that still leaves us $303,000 into the money, and that's with about 6 months, maybe 6.5 months worth of expenses. So those adult placements for emergency detentions continue to be a driver, and that's true of all of the counties around us as well, because the mental health beds just don't exist.
Okay. Just looking to see where that was budgeted. Questions or comments for Chris from the committee? Or from Mr. Miller or our CFO?
We're
Supervisor.
here to answer questions rather than ask them. We've already asked the tough ones.
Yes, Supervisor Steen, you're muted, please.
Yeah, here's a question for Paul or Dave. If I'm understanding this correctly, we are not giving the step increases just a 2%. Is that going to be countywide then, all departments?
That
It is.
That is the proposal right now, Supervisor Steen. Whether or not it ends up being what happens when we attempt to reconcile the entire county budget remains to be seen. But at this time, yes, when we did the evaluation, knowing that we were going to have shortfalls, it seemed more fair for everybody who's on the pay grid to do an adjustment to the pay grid and not do steps, rather than do steps and no adjustment to the pay grid, because the latter situation would have those at the top grade not getting any salary adjustment at all. Of course, the cost of doing both, it would have made our initial deficit on the budget greater than the $1.1 million we started with. So at right now, the working proposal is a 2% adjustment to the pay grid with no steps, and it would be across the county.
I got one other question for KT. Now, if I understand you correctly, you're anticipating a $250,000 pot of money coming for next year for the
Yes.
COVID stuff. Is that correct?
Right, so like we have the $328,000 this year for contact tracing, recognizing that it is unlikely that COVID will stop anytime soon in our need to respond to it with contact tracing and disease management. So this is some money for next year. And I have not seen anything in writing, so it's not included in our current budget.
Yeah, that answers my question. We're not assuming that we're going to get it, so it's not budgeted, correct?
Not just yet.
Thank you.
Other questions for Chris or Sarah or KT? Are we ready to take action on the budget for Human Services?
I move we approve.
Supervisor Steen moves. Is there a second?
I will.
Mr. Lamb seconds. Any further discussion? All in favor, say aye.
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 The budget for Human Services for 2021 is approved to send on. Thank you, everybody. We have a couple of additional Human Services items. We do have, although it's not listed separately, we do have a budget adjustment in the amount of $648. You have that budget adjustment in your packet. It's all in the same sheet.
You know, we did an agenda, and I did a terrible job, apparently. I must have fallen off the potato truck.
Well, that's what we'll consult, and then the things I forget, you can add, and the things that you forget, perhaps.
I guess. However, what I would say is it's irrelevant to our operational capacities for us to withhold that $600 until next month.
Let's
I
go
move
ahead
we
and
approve.
let's go ahead and approve it. The budget adjustment. Do I have a motion?
Actually,
Mr. Miller?
you probably cannot. Strictly speaking, if it's not agendaed as a business item, you can't take the action.
Well,
The best
that
thing to
is-
do is as Chris Corpola recommended, simply defer it to next month.
All right, that is true. They do always come to us on a single sheet, but we've been acting on them separately. All
And
right.
I had agended the public health budget adjustment, but I did not agenda the DHS budget.
That is
budget
correct.
adjustment. So if it
All
were
right.
$6 million, I might be sweating, but $600, I think we can do it.
Another item to move to September.
Yes.
We have vouchers paid for the month. You wanna, anything that you want us to, Supervisor Steen?
I move that we approve that we reviewed the vouchers.
That we've received the vouchers. Is there a second on that? Committee members, do I have a second? Ms. Gromrey, thank you. Any further discussion? Anything you want to point out?
No, nothing of significance.
I just have a question. What is Rawhide Incorporated?
It's a residential treatment facility for youth.
Okay.
I think the chairman may have puppies on her brain.
The puppies, yes.
Rawhides.
Yeah, yes, she does. Absolutely does. All right. To approve, to receive the vouchers, all in favor?
Aye.
Aye.
Aye. Any opposed? Thank you. And finally, we have the Wisconsin Heating and Energy Assistance Program. Do you want to go through that again, Chris?
Certainly. So I would just make a note that I learned something in this process. I've called it the Wisconsin Heating and Energy Assistance Program forever, but it's actually the Wisconsin Home Energy Assistance Program. So when we when the motion, if and when the motion is made, it would be actually to recommend administration of the Wisconsin Home Energy Assistance Program change. Actually, as I indicated, we looked at three things in considering the recommendation to make this change. Those would be the cost of the service, the personnel that would be involved, and the quality of the services provided. Again, because about 2,000 Dunn County recipients receive energy assistance payment in a particular year, and we process all of those. We were concerned about the quality because we've done a good job as well. However, WestCap has done a fine job this summer. Absolutely no complaints, a seamless transition to them being the summer provider. And they have been providing those services in St. Croix County without issue for several years. With regard to the personnel, it is a very small program from a personnel standpoint, one part-time staff person who works 1,560 hours a year. However, WestCap is willing to hire her, and they are also willing to hire her full-time, in which case she would become a benefited position with them. So it's advantageous, and she is actually in favor of that change. And the third is the cost. So while not directly automatically reflected on the front side, on the budgeting side, by the time all is said and done, and we claim all the little bits and pieces of all the things that go into this program, including a little bit of the clerical staff who have to answer the phones and process the appointments for 2,000 people, and a little bit of the people in the fiscal department who process the claiming, and all of those pieces, it ends up costing us about over the last several years, the average has been about $15,000 in levy in what we've spent. So we don't budget for that levy on the front side, but it becomes part of what's consumed over the course of the year. And so there would be that immediate savings. So the recommendation is to authorize the move of the Wisconsin Home Energy Assistance Program contracted administration from us to WestCap. And that would happen actually almost immediately, because the energy assistance program, energy assistance season starts here in another month.
Right. I would entertain a motion to transfer the Wisconsin Home Heating and Energy Assistance Program from Dunn County to WestCap.
Oh, go ahead.
Supervisor Bjork moves. Is there a second?
I will. This is Bill.
Mr. Lamb seconds. Any discussion, questions?
Madam Chairman.
Yes, Mr. Supervisor
I
Bjork.
thought, I was really pleased to read this when it came up because I thought it was kind of a natural. It's been my understanding that WestCap has also been very active in winterization and helping
Yes.
people save, fuel and energy, and seems like a really nice fit to have this transferred with what they're already doing with helping people through the winter.
Yes.
Agreed. Other questions, comments, discussion? Are we ready for a vote? All in favor of transferring the Wisconsin Home Heating and Energy Assistance Program to WestCap, say aye.
Aye.
Aye. Motion passes unanimously. Anything else, Chris? We are moving through this agenda quite quickly. I'm surprised.
I have nothing else.
Nothing else? Any other questions or comments from the committee? If not,
Oh,
I just-
Larry's.
I'm sorry.
I was late to the meeting. I appreciate your patience with me, and I just wanted to pass along what I'm feeling is a good job that our departments are doing, and very difficult times, and a lot of responsibility, and you got people way on every edge of this discussion on where we at with COVID, and it's really nice to have Dunn County at least be steady in the way they're presenting it. So way to go, guys.
Thank you, Supervisor Bjork. I agree. And also compliments to our CFO and Mr. Miller and everybody in this budget process, which is a lot of hard work. So
I do have one other item. Someone amongst us is spending their birthday evening here. Miss Sarah Stabenow is turning 27.
happy birthday.
Or maybe that was 47. Oh, wait, no.
Happy birthday.
Happy birthday, Sarah. Maybe there'll be a little cake
Happy birthday.
Thank you.
somewhere. Lovely. Without objection, we are adjourned.
Thanks, everyone.
Thank
Bye,
you,
everybody.
everyone. Stay
Bye.
safe,
Bye.
please.
Stay healthy.
Bye.